Hi, this is a preview on metabolic disorders.
This is a 9-month-old girl presents with vomiting and lethargy. Her labs are normal except metabolic acidosis with ketonuria. Her physical examination is unremarkable except generalized or general weakness and odor of sweaty feet. What is the most likely diagnosis? Isovaleric acidemia, propionic acidemia, methylmalonic acidemia, maple syrup urine disease, glutaric acidemia type 1. The correct answer is isovaleric acidemia. Isovaleric acidemia is a type of organic acidemia. The key word for this disease is odor of sweaty feet. Odor of sweaty feet. Isovaleric acidemia. Remember, sweaty feet odor in organic acidemia is isovaleric acidemia. So we have an infant presenting with vomiting, metabolic acidosis, pancytopenia, encephalopathy, and sweaty feet odor. The most likely diagnosis is isovaleric acidemia. Diagnosis of isovaleric acidemia: order urine organic acids. This will show elevated C5-acylcarnitine. Confirm the diagnosis with DNA testing. I will start here with a clinical case scenario. A newborn with caramel-like odor or bittersweet, sweet smell concentrated in urine and earwax, feeding difficulty, irregular breathing, loss of motor reflexes, severe seizures, obstetricous rigidity, died few days after birth from cerebral edema. What is the most likely diagnosis? Urea cycle defect, propionic acidemia, maple syrup urine disease, galactosemia. The correct answer: maple syrup urine disease. The key word for this disease is caramel-like odor or bittersweet or sweet smell concentrated in urine and earwax, plus encephalopathy and intractable seizure, and if it's not treated on time, they will die from cerebral edema. Maple syrup urine disease commonly presents during neonatal period with poor arousal and poor feeding. If it's not diagnosed or is not managed quickly, this infant can go for coma and death. Is because of deficiency of branched chain alpha ketoacid dehydrogenase enzyme. The key word for this disease is elevated leucine, isoleucine, valine, and allo-isoleucine. Elevated allo-isoleucine is diagnostic. They may have metabolic acidosis and ketosis. The reason for the maple syrup smell is the leucine. But if the leucine is not elevated, you will not have the maple syrup urine smell, and this does not rule out this disease. So do not use maple syrup for screening. If it's available, is helpful in the diagnosis, but if it's not there, this does not rule out this disease. Very important. Classic presentation of maple syrup urine disease is urine smells like maple syrup because of elevated leucine level. Usually presents between 3 to 5 days of life with feeding difficulty, irregular respiration, loss of motor reflex, severe seizures, and death from cerebral edema if is not treated. Treatment is dietary control of leucine, isoleucine, and valine. Alkaptonuria. Alkaptonuria is autosomal recessive disease due to deficiency of homogentic acid dioxygenase. Diagnosis of alkaptonuria: presence of homogentic acid in urine and DNA testing. Remember the keywords: black urine when left exposed to the air, and dark spots on the skin and connective tissue. Management of alkaptonuria: reduction of phenylalanine and tyrosine, vitamin C, removal of lumbar discs with fusion if the lumbar spine is affected, joint replacement if major joints are significantly affected. This is a child is complaining of bone pain and growing pain. On the physical exam, the spleen is very large. You order CBC to rule out leukemia. The CBC was significant for thrombocytopenia and anemia. What is the most likely diagnosis? Of course, leukemia will be in the top differential in this presentation, but bone marrow biopsy will confirm the diagnosis of Gaucher disease and other testing as well. Gaucher disease is due to deficiency of glucocerebrosidase enzyme. It is autosomal recessive. This will lead to deposition of glucocerebroside in the cells of the macrophage monocyte system. This will cause infiltration of these cells in the bone, and this will lead to bone pain, anemia, thrombocytopenia, and also these cells will deposit in the spleen and will cause very large spleen. Classic presentation of Gaucher disease: growing pain in lower extremities, especially at night due to bone infiltration, skin hyperpigmentation, abdominal protuberance, very large spleen, massively large spleen. Remember that hypersplenism, significant thrombocytopenia, severe bleeding, pallor, and anemia.
Diagnosis of Gaucher disease from the clinical presentation and confirmation with bone marrow aspiration or biopsy. This will show Gaucher storage cells, which is wrinkled paper-like tissue. Deficiency of glucocerebrosidase in leukocytes and culture skin cells. Loss of bone tubulation on radiography and DNA testing. Management of Gaucher disease, enzyme replacement therapy for type 1 Gaucher disease. Splenectomy is contraindicated.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.